Alright, let's dive right in. If you're prepping for the NCLEX 2025, this is the video you cannot miss. Whether you're just starting your study journey or you're in the final stretch before exam day, this guide is packed with the most up-to-date, high-yield information you need to know. The NCLEX is changing, and so is the way you need to prepare. In this video, we're not just going to skim the surface. We're going deep into the most commonly tested topics, the trickiest questions, and the strategies that top scorers use to pass on their first try. So grab your notes, get comfortable, and let's get started on your path to becoming a licensed nurse. I've dug through the most common questions, and I'm not just giving you the answers, I'm giving you the why behind them. Understanding the rationale is what separates a good nurse from a great one, and it's exactly what the NCLEX is testing for. We'll break down each concept, walk through real-world scenarios, and make sure you know not just what to do, but why you're doing it. This approach will help you think like a nurse, not just memorize facts. Let's get started. First up, delegation. You'll see this again and again. Delegation is one of the most frequently tested concepts on the NCLEX, and for good reason. It's a critical skill in real-world nursing. The exam wants to know if you can safely assign tasks to the right team members, ensuring patient safety and efficient care. You'll be given scenarios where you have to decide who does what, and it's not always as straightforward as it seems. The key is to know the scope of practice for each role on the healthcare team: registered nurses, RNs, licensed practical nurses, LPNs, and unlicensed assistive personnel, UAPs. Sample NCLEX question #1. A nurse is caring for 4 patients. Which task is most appropriate to delegate to the unlicensed assistive personnel, or UAP? A. Assessing a patient's pain level. B. Administering oral medications. C. Assisting a stable patient with a bed bath. D. Teaching a patient about insulin administration. The correct answer is C. Assisting a stable patient with a bed bath. Here's why. UAPs can assist with routine, non-complex tasks for stable patients. Assessment, medication administration, and teaching are outside their scope. Remember, if a task involves assessment, teaching, or an unstable patient, it should not be delegated to a UAP. Here's the golden rule. RNs can delegate tasks like vital signs or bathing to UAPs, but never assessments, teaching, or unstable patients. UAPs handle routine, stable tasks. Think feeding, ambulating, toileting, and basic hygiene. LPNs can do more, like administering certain medications, wound care, and monitoring stable patients, but they still can't assess, teach, or handle unstable patients. Only RNs can perform comprehensive assessments, create care plans, provide patient education, and manage patients whose conditions are changing or unpredictable. If you're ever unsure, ask yourself, does this task require critical thinking, judgment, or teaching? If yes, it stays with the RN. Sample NCLEX question #2. Which patient should the RN see first? A. A patient with a headache requesting pain medication. B. A post-op patient with a blood pressure of 88/50 millimeters of mercury. C. A patient asking for assistance to the bathroom. D. A patient scheduled for discharge later today. The correct answer is B. A post-op patient with a blood pressure of 88/50 mmHg. This patient is unstable and at risk for shock. The RN must assess and intervene immediately. Always prioritize unstable patients or those with abnormal vital signs. Remember, safety and scope of practice are your friends. The NCLEX loves to test whether you know what each member of the healthcare team can legally and safely do. If you're ever stuck between 2 answer choices, pick the one that keeps the patient safest and stays within the scope of practice for that role. Next, let's talk infection control. This pops up everywhere. Infection control is a cornerstone of nursing practice, and the NCLEX will test your knowledge of standard and transmission-based precautions. You'll need to know which diseases require which precautions, what personal protective equipment to use, and how to prevent the spread of infection. Sample NCLEX question #3. A patient with tuberculosis is admitted to the hospital. Which infection control precaution is required? A. Surgical mask and private room. B. N95 respirator and negative pressure room. C. Gown and gloves only. D. No special precautions. The correct answer is B. N95 respirator and negative pressure room. Tuberculosis is airborne, so you need an N95 mask and a negative pressure room to prevent the spread of infection. Airborne precautions are for diseases like TB, measles, and chickenpox. Use an N95 mask and a negative pressure room. These diseases are spread through tiny particles that can linger in the air, so you need special protection. Droplet precautions are for diseases like flu, mumps, and pertussis. Wear a surgical mask within 3 feet of the patient. Always remember, hand hygiene is crucial. And if in doubt, hand washing is always the right first step. Hand hygiene is the single most effective way to prevent the spread of infection. Sample NCLEX question #4. What is the most effective way to prevent the spread of infection in the hospital? A. Wearing gloves for all patient contact. B. Using hand sanitizer after every procedure. C. Washing hands before and after patient contact. D. Placing all patients in isolation. The correct answer is C. Washing hands before and after patient contact. Hand hygiene is the most effective infection control measure. Always choose hand washing if you're unsure. Now, prioritization. Who do you see first? Prioritization questions test your ability to recognize which patients need immediate attention and which can safely wait. The NCLEX uses these questions to see if you can think critically and act quickly in a busy, real-world environment. Always pick the unstable patient. Chest pain beats a headache every time. Use ABCs, airway, breathing, circulation. Sample NCLEX question #5. Which patient should the nurse assess first? A. A patient with a history of asthma who is wheezing and has labored breathing. B. A patient with a sprained ankle requesting ice. C. A patient with a mild headache. D. A patient asking about discharge instructions. The correct answer is A. A patient with a history of asthma who is wheezing and has labored breathing. Airway and breathing issues always take priority. The ABCs, airway, breathing, circulation, are your guide. If 2 patients both seem urgent, choose the one who's most at risk for sudden deterioration. Look for clues in the question: vital sign changes, new symptoms, or a history of rapid decline. And don't forget patient teaching. Education is a huge part of nursing, and the NCLEX will test your ability to teach patients about their conditions, medications, and treatments. And don't forget patient teaching. Education is a huge part of nursing, and the NCLEX will test your ability to teach patients about their conditions, medications, and treatments. Sample NCLEX question #6. A patient is prescribed a new antihypertensive medication. What is the nurse's priority teaching point? A. Take the medication with food. B. Report dizziness or lightheadedness. C. Avoid dairy products. D. Take the medication at bedtime. The correct answer is B. Report dizziness or lightheadedness. These may indicate hypotension, a common side effect of antihypertensive medications. Always teach patients to report symptoms that could signal a serious problem. Look for choices that empower your patient to stay safe and independent. The NCLEX loves answers that promote patient autonomy, safety, and self-care. If you can teach a patient to do something for themselves safely, that's almost always the best answer. Encourage your patients to be active participants in their care, and you'll be on the right track for both the exam and real-world nursing. If you found this video helpful, make sure to subscribe to Pass NCLEX Academy for more tips. Click the link in my caption below or in my bio to get access to comprehensive, high-yield NCLEX exam strategies. Good luck, and see you in the next video.